is I'll be doing the manual muscle testing for an SCI patient. So I'll be starting with the C5 elbow flexors, which are your primary muscles, are your biceps brachii and your brachialis. So for the grade 3, patient position is the shoulder is in neutral rotation, flexion, extension, and adduction. And for the elbow is fully extended, forearm is supinated, and wrist is in neutral flexion and extension. So patients or examiner's position is just supporting the arm of the patient. So wrist of the patient, then the instruction is that, ma'am, I want you to try to bend your elbow and reach your nose. So that's for the grade 3. For the grade 4, for the patient's position is the shoulder is in neutral rotation, elbow is flexed to 90 degrees, forearm is fully supinated. The examiner is stabilizing the head and the wrist of the patient and the anterior part of the shoulder. And the instruction is that, ma'am, maintain this position, do not let me move it down. Okay. Next is for the grade 2. So for the grade 2 is patient position is shoulder is in internal rotation and adduction. Forearm is positioned above the abdomen, just below the umbilicus. And the elbow is 30 degrees flexed. Forearm and wrist is in neutral position, pronation and supination. Then I'll be supporting the wrist of the patient or the arm, and my other hand is in the elbow of the patient. And my instruction is, ma'am, I want you to bend your elbow towards your nose. Okay. For the grade 1 and 0, same position. The patient is shoulder internal rotation and adduction. Palm is in ventral forearm and above the abdomen. Elbow is 30 degrees flexed. Forearm and wrist is in neutral pronation and supination position. And my arm position is in wrist, and my other hand will be palpating the biceps brachii of the patient. Same instruction with the grade 2. Ma'am, I want you to bend your elbow towards your nose. Next is your C6, wrist extensor. So your primary muscles are your extensor carpi radialis longus and your extensor carpi radialis brevis. So for the grade 3, patient position, the shoulder is in neutral rotation, flexion, extension, and adduction. And the elbow is fully extended, forearm is pronated, and the wrist is flexed. The examiner's position, one hand supports the distal forearm to allow the wrist to be pre-positioned in sufficient flexion for testing. So my instruction will be, ma'am, I want you to bend your wrist towards upward or towards the ceiling and lift your fingers toward the ceiling. Okay. Wait, so. Next is for the grades 4 and 5. So patient position is same as a grade 3, except the wrist is fully extended. And then grasp the distal forearm to stabilize the wrist. And then apply I want you to close your hands, mom. And then apply pressure across the mid-carpal into downward direction. Then, ma'am, I want you to hold your wrist up. Don't let me push it down. Okay. Next is for the grades 0, 1, and 2. So patient position is the position of the patient with the arm resting on the examiner's exam table, and the shoulder is in neutral flexion extension. The elbow is fully extended. The forearm is in neutral pronation supination, and the wrist is fully extended, fully flexing. And then for the examiner's position, I'll be supporting the forearm and ask the patient to bend backwards to extension for trace function. Then I'll be palpating the radial wrist extensor just proximal to the wrist on the radial aspect of the distal arm. Yes. Okay.
Go.
Next is C7 elbow extension. So the primary muscle is your triceps. So for grade 3, patient position, the shoulder is in neutral rotation, adducted, and 90 degrees of flexion. The elbow is fully flexed in the palm of the hand and resting by the ear. So the examiner's position is I'm gonna support the upper arm, and then I'm gonna instruct my patient to straighten your arm toward the ceiling. Okay. For grade 4, patient position same as grade 3 except the elbow is in 45 degrees of flexion. 45 degrees of flexion. Then examiner position is I'm gonna support the upper arm while grasping the wrist and apply resistance to the distal forearm in the direction of elbow flexion. So my instruction will be I'm gonna hold this position, then don't let me push it down. So, okay. For grade 2, so patient position is in internal rotation and adducted with the forearm position in the abdomen, and the forearm is in neutral pronation or supination. The elbow is fully flexed. So examiner position is I'm gonna support the patient arm. Then I'm gonna instruct the patient to straighten your arm. Next is for the grades 0 and 1. So patient position is maintain the grade 2 position, same with the grade 2 position, with the shoulder in internal rotation and adducted, and the forearm is positioned above the abdomen, and the forearm is in neutral pronation or supination, and the elbow is in 30 degrees of flexion. So the examiner's position is I'm gonna support the arm of the patient for trace of function and palpate the distal triceps, and at the insertion of the olecranon and the belly of the triceps muscles may also be palpated and observed for movement. So my instruction will be I want you to straighten your arm, then I'm gonna palpate the triceps. Next is C8. So long finger flexor. So your primary muscle here is your flexor digitorum profundus. So for the grade 3, the shoulder is in neutral rotation, neutral flexion, extension, and adduction. The elbow is fully extended, with the forearm is fully supinated. The wrist is in neutral flexion, extension. MCP and your PIP are stabilized in extension. So the examiner's position is using two hands, grasp the patient hand and stabilize the wrist in neutral. Secure the PIP and the MCP joints in extension with both hands isolating the middle finger for testing. Stabilize the volar aspect of the third middle phalanx with the thumb of the opposite hand. So I'm gonna instruct the patient to bend the tip of your middle finger towards the ceiling. Okay. Next is for the grades 4 and 5. So same position as the grade 3, except the DIP joint is fully flexed. Then the examiner position is stabilizing the wrist and the MCP and the PIP joints as in grade 3, same as grade 3. Then apply pressure with the tip of the finger or the thumb against the distal phalanx of the patient's middle finger. So I'm gonna instruct the patient to hold the tip of your finger in this bent position, then don't let me move it down. Okay. Next is for the grades 0, 1, and 2. So the shoulder is in neutral position, neutral rotation, neutral flexion, extension, and adduction. The elbow is fully extended. The forearm is in neutral pronation and supination, and the wrist is neutral flexion, extension. The MCP and the PIP joints are stabilized in extension. So the examiner position is I'm stabilizing the wrist in neutral, and the MCP and the PIP joints in extension. For trace function, palpate the tendons of long flexors or observe the muscle belly for movement. So and then instruct the patient to bend the tip of your middle finger. Then I'm gonna palpate. Okay. Next is for T1 small finger abductor. So your primary muscle here is your abductor digiti minimi. So for grade 3, patient position is the shoulder is in internal rotation, adducted, and 50 degrees flexion. The elbow is at 90 degrees flexion and the forearm is pronated. The wrist is in neutral flexion extension. So for the examiner's position, support the patient's hand, taking care to assure the MCP joint are stabilized to prevent hyperextension. So my instruction will be, I want you to move your little finger away from your ring finger. Okay. Next is for grades 4 and 5. So same as grade 3, except the little finger is fully adducted already. Next is the examiner position is I'm gonna support the patient's hand, taking care to assure the MCP joints are stabilized to prevent hyperextension. So I'm gonna use my index finger to apply pressure, or any finger to apply pressure against the side of the patient's distal phalanx. So hold your little finger away from your ring finger and don't let me push it down. Okay. So for grade 0, 1, and 2, patient position is shoulder is in neutral rotation, neutral flexion, extension, and adducted. The elbow is in fully extension. The forearm is full pronated, and the wrist is in neutral flexion, extension. So the MCP joint is stabilized. So the examiner position is to stabilize the dorsal wrist and of the hand by pressing down lightly on the back of the hand. Be sure that the MCP joints are stabilized to prevent hyperextension. And palpate the abductor digiti minimi muscle and observe the muscle belly for movement. So, ma'am, I want you to move your little finger away from your ring finger. Okay.